Welcome to the live stream. It's been a while since I've been able to update you live. I'm trying a new software system to be able to show you my desktop as well as the webcam because YouTube's native streaming software doesn't allow me to switch, and I wanted to be able to demonstrate some of the things we've been doing in recent weeks. But let me start off talking about the status of our various partnership discussions. I know many are anxious to hear official word on those. We can confirm the official alliances with sequencing.com and Genomics Personalized Health still. We're working on finalizing additional partnerships, and because we're a company now that's rather mature, and we're dealing with companies that are rather mature, the nature of these partnerships and the announcements surrounding them are a little more complex. They are, they're not just announcements to the world that, oh, we're going to partner with someone. They involve legal documentation and definitions of responsibilities, etc. So, be patient while we sort out all that paperwork. People are, some people are on holidays, but all of that will be sorted out shortly. As I've mentioned, we have one partnership we're very excited about with a genomics data broker, and we hope that will help to lure numerous customers onto the gene chain by way of employee health plans. So that's the idea, and that's the goal. That's going to be an exciting new method to get people onto the gene chain. So let me tell you why it's really important for us to make sure that when we're getting data onto the gene chain, it's not just genomic testing data, but it's also combined with phenotypic data. So somebody says the audio is loud. Let me just, maybe it's me, maybe I'm talking too loudly. All right. What makes the genomic data valuable when pharmaceutical companies or others wish to buy it is not just the data itself. So if I take a genomic data test and get the raw data file, which I've done, I did a 23andMe test, and I downloaded the raw data file, but I didn't give them the most valuable part. Right? So they have that raw genomic data, but they really can't sell it because I never did the health profile. They keep pestering me with emails asking me to do that, and I of course am not doing so. Instead, I put it up on the gene chain. So in order to make this data valuable, we really have to combine it with our some information about the person, and that's where the platform comes in. And as you can see, we've included a number of new things into the profile, and we will be launching with these and a few extra characteristics that will make it easier for people to be able to search for and buy data and make that data really valuable. The partnerships that we're working on are not ones that will get tons of data in immediately, but ones that will encourage people like employees, etc., to download their data, upload it to the gene chain, and add phenotypic data. So no matter how it works, the populating the gene chain is going to be a gradual process. There's no way to overcome that, because whenever that data is added, in order to make it valuable, it's going to have to be accompanied by phenotypic data, which means the user himself or herself is going to have to enter that data along with the data that they upload. All right, so additional partnerships we're working on. I have a number of new ones that we're working on, and most in the crypto space, including with some startups in healthcare and blockchain, and one also that is a potential payment solution portal for crypto to fiat. So those are new. Again, I will talk more about them when they become more substantive, and we have something actual to announce. So yeah, a number of other things that are going on. We have a couple of speaking engagements coming up, which I've mentioned. One is the Health Further Conference in Tennessee. Nashville, Tennessee is a big center for health, and that conference will be an exciting opportunity to get the word out to the healthcare field, but also in the VC space. So this is a conference organized by some VCs in healthcare and technology. I'll be speaking on a panel on tokenomics and health, and that'll be Nashville, Tennessee, August 29th. And then in October, another one that's organized by VCs, the LSX World Conference. There's a lot of big names here in healthcare, and you can see we're on the docket here to give some discussion about EncrypGen's work in genomic blockchain. Oh yeah, that's me, you can see. So that's exciting. We're getting more opportunities like these to get the word out and to explain to the world what is coming with our exciting marketplace. Now, I want to talk a little bit about the platform progress. So as I mentioned, we have some new fields here. You can add physical characteristics. Now these are not imperial measures, these are metric measures, but we'll be including imperial as well. You can fill out as much or as little of this as you want, as well as your Ethereum address, and you can update this whenever you want. The settings and privacy, let me explain that to you a little bit. So for now, we have to have you confirm that you're not a European citizen or resident, because in order for us to process data consistent with the GDPR regulations in Europe, we have to allow you to be able to delete that data. Now, delete is working in the dev environment. We haven't released it yet. There's a couple of things we want to make sure work. It involves deleting a number of different associated files. So once that delete function is up, you won't have to do this anymore. But you'll always have to do this. You have to confirm you're happy to have your genomic data processed. Okay? So that's what's going on with that part of the platform, the MyGeneChain portal, and that's pretty much ready to go. What's going on behind the scenes is all very complicated, and I can't really demonstrate it for you, but it involves the indexing of that data. So by processing the data, what we're doing is indexing it in a way that makes it useful for genomic scientists, and that means we have to look and align all of the different fields for consumer genomic data tests, so that you can search across different types of tests. You can search for specific genes and specific SNPs, single nucleotide polymorphisms, data that really makes it relevant for a researcher, along with the various profile data here. So indexing is not a trivial task. This is a major part of what makes the platform valuable. And it's taking a long time. We're going to be ready for planned launch of the beta in quarter 3, and by then there will be a fully functioning, searchable, buyable marketplace for genomic data. So that's stuff that's going on behind the scenes that you can't see, that I can't really show you, that we'll be able to demo in the next couple of weeks, I'd say, some of the search functionality in a very wonky way. All right, now more exciting stuff on the blockchain side. This is a demo of the wallet. So half of the product is blockchain transactions, the stuff that makes it possible to buy and sell the data, and the other part is the indexing and the cross-referencing and correlating of that data, and then the searching. So almost all of that is complete now. Here's a demo of the online version of the wallet. Now, I hope you're able to see this. This is another version of the wallet which I've shown some screenshots of. This is a jar file that we're using for our demo. And we've got it working. So the blockchain works. Transactions, the capturing of the transactions, exporting the data. Now the jar file is not what people are going to be using. This has been developed to try to show the technology. This is really still the nuts and bolts of what the blockchain consists of. But I want to demonstrate some of what the online wallet will do by doing a transaction from the online wallet to from the online wallet to my jar wallet and vice versa. So let's suppose we want to send some money. We found the data we want to purchase. All of this, of course, is going to be automated, and then I want to send some of that data, or pay for that data, and so I'm going to be really cheap and send 3 DNA. Here's the online wallet doing its business, and it took a commission, so that's how we actually make money. And then my jar wallet shows the incoming amount. So all the blockchain is functioning so that we can not only send the payments, capture the payments, create a record of those payments, and the data they relate to, but also take our commission, which is how we make money. So I know it may look trivial, but it's not. This is a bespoke blockchain. It's not like other blockchains that exist. It is the fundamental blockchain of our system that is doing all the work. So what happened here is we have a DNA multi-chain blockchain, and that's where all the work gets done. So you'll be able to put your DNA from, say, your exchanges into this web wallet, and then do all your transactions for data online. This is going to be incorporated with the marketplace here. So I can't overstress how close we are to having a fully functioning marketplace. The search functions are working in development, as I said, and then after you do a search, the part that has to be completed is the purchase. You'll click and you'll purchase for the amount that the person who uploaded that data has set, and then you'll get your data. So it's tremendous progress. I'm incredibly proud of the team for all the work they've done, and they're working, around the clock, quite literally. They are just incredible workers, and we're so far ahead of everybody else because of them, and I can't stress it enough how thankful I am to them. And so, what does this mean? This means that as these parts come together, where people are able to upload the data, which they're already doing, and add this sort of data to it, what we'd called in the past metadata, but really profile data. And then researchers can search by that, as well as the genomic data, find data sets that they find valuable, buy them using what I've just demonstrated, the blockchain that's working. And we'll have the world's first functioning genomic marketplace, which is a tremendous development and is going to change the economics of genomic data sharing. So I want to talk just briefly before I wrap this up. As I said, I can't see the questions on YouTube. I don't know why I can't, but I will answer those asynchronously in the comments section. But before I wrap it up, I want to talk to you a little bit about the economics of it. I've talked many times about how 23andMe, their business plan works. It's really quite an amazing product they've delivered and developed, and their business plan is also quite remarkable. So the business plan for them is get people tested, and the testing is more or less geared towards ancestry and other sort of what we might call cosmetic issues. There's some health data you can get, again, all very statistical and not determinative. But nonetheless, people are buying it. About 5 million have purchased 23andMe tests. Every test that 23andMe sells, they sell at a loss. They are using the Illumina global array. That array is not cheap, but it's not terribly expensive. It's certainly they're not at the price that 23andMe is selling their tests for. They're not making a profit off of the sales of the tests. What they're doing is they're reselling data with the consent of people who are doing those tests for pharmaceutical and other research. And they're selling it because they're able now to correlate the health data to the data sets that have been uploaded in a way that makes it valuable for researchers. All we are doing is altering that process slightly. We're saying, listen, since you've already been tested, you've already consented to have your data used, and I should say over 4 million people have already consented to have 23andMe resell their data. They have no problem with it. There's nothing to lose, we say, by your uploading the data. You can easily download your raw data from 23andMe and also upload it to our platform and see if anyone will buy it directly. Now, we think this is revolutionary for a number of reasons. One is it'll bring the price down for researchers, for pharmaceutical companies and university researchers. Instead of only having really one or two major places they can go to get that kind of data, they'll be able to go directly to consumers who've already done tests and already consented to have their data used, and do so with us. And now, you as an individual will get to try that and see if you can get paid directly for it and get it in DNA. Now, not only is that going to drive down the price of data for researchers, we think it'll have repercussions in a broad sense for health markets, such that the cost of healthcare itself will, we think, begin to fall. Individuals will begin to profit off their own data in ways that are, we think, revolutionary, and that blockchains are really responsible for in the near future. We're all going to be able to have a better understanding of the role of our own data in our health as well as in scientific research. So this is a first step. We're on track for the current roadmap, which is on the website. Because I haven't updated in a while, I thought I would give you some previews of some of the progress that's been made. Show you a little bit about the platform's development and where we are as a company. So we're still, I think, the world's leader in the field of blockchain genomics, and we intend to keep it that way. And we'll keep it that way by careful and progressive development of the platform and by smart business decisions. So because it's going to be a free market where we take the profits off the commission, we don't have to have a sales force out there selling products to companies. Rather, we're going to put our efforts into marketing through the channels we've already developed, which include a highly detailed customer relations management database that we think shows about 5,000 potential data buyers that we can reach out to through direct email, get them to try this out. The marketplace itself is going to be just an incremental change from what you see here, where as you log in as a data buyer, see something like this and click the selections you want to search, and then you'll get a list. And I'll be able to demonstrate that in a few weeks as well. So that's where we are, and that's where I think we're going. We're going to have the world's first genomic data transaction on the world's first genomic data marketplace, and on track and within the time frame specified in our roadmap. So again, I'll answer questions asynchronously on the comments part of our YouTube channel. I'm unable to see them right now, but I appreciate your ongoing support, your interest, and it's a real honor to work with such a team that's able to produce this sort of groundbreaking software. thank you, and I'll try to keep you updated a little more regularly, and I'll see you soon.